Statins are some of the most widely taken and best-selling drugs of all time. They are intended to reduce cholesterol. And when I talk about cholesterol, I mean specifically this molecule. I don't mean LDL particles or anything else. I'm talking about a discrete molecule called cholesterol. I say that clearly because some physicians use cholesterol and LDL interchangeably. LDL is a measure of the number of low-density lipoparticles in the blood, but it's not the same as cholesterol. Cholesterol is contained in LDL, but LDL contains other things, notably triglycerides. And that, I think, is a source of confusion. I've made a video about that before. Where does cholesterol in the body come from? 80% is made inside cells. What cells? Nearly all cells make cholesterol. The blood, for instance, makes a small amount of cholesterol, but some cells make much more cholesterol than others, notably the liver. The liver packages cholesterol in these LDL nanoparticles and distributes it into the bloodstream, where the LDL delivers cholesterol and triglycerides to the cells which need nutrients. Only 20% of the cholesterol in your body comes from food. Now, as an aside, I would just like to say that the dilemma about eggs 10 years ago were probably bad for you. Now eggs are good for you. Eggs are high cholesterol food. Now people are arguing it doesn't matter. You can eat high cholesterol food. When I compare, say, a plate of eggs with a plate of equivalent number of calories of something fried in vegetable oils, I think most people could look at those two and say, well, it's not the eggs that are most harmful, it's the other thing. And maybe that's because of oxidized lipids. And I've argued that point before in yet another video. But that's an aside for this one. This is a cell then. How do we get from a cell to an atherosclerotic plaque? Because after all, when people take statins, they're trying to stabilize plaque in the arteries. Statins lower cholesterol by inhibiting an enzyme called HMG reductase. HMG reductase is the star of this story. However, the story is not just about cholesterol because HMG-CoA reduced by HMG-CoA reductase is pivotal for the generation of other things. And let's see how that story evolves. The biosynthesis of cholesterol begins with this ubiquitous molecule, acetyl-CoA. Acetyl-CoA structure is quite complicated, more complicated than we need to worry about. Let's just abbreviate that to S-CoA. Acetyl S-CoA functions to deliver acetate, a C2 unit, that big molecule, all just to deliver 2 carbons. And in a series of 3 or 4 steps, which are actually easy to understand for a chemist, we put together 1, 2, 3 acetyl-CoAs, and we form this carboxylic acid here. This is called HMG-CoA. What does HMG stand for? A long chemical name. So let's just call it HMG-CoA. Now is the key step, HMG-CoA reductase. That enzyme takes the carboxylic acid that you see down to a CH2OH. It's a reduction step. And that is the one inhibited by statins. Let's just look at a couple of statins, almost household names these days. Torvastatin, and the brand name for that is Lipitor. There's another one called rosuvastatin, and the brand name for that is Crestor. These are 2 of the most powerful cholesterol-lowering drugs. Other drugs have the same effect, but they don't lower the cholesterol as much. What happens after that reduction step? I'm not going to tell you in this video. I'm not going to tell you because it's many steps, and this is not really a chemistry video. Somehow, that alcohol, mevalonate, is converted in many steps, which honestly, I can't even remember, to give cholesterol. But there's a problem. Mevalonate is converted in many steps to give other things. And quite logically, some of those other things are steroids too, like testosterones, sex hormones. It's also involved in the production of vitamin E. But the one I want to focus on is coenzyme Q10. So let's get this clear. I'm talking about mevalonate. If we impede the synthesis of mevalonate with statins, then sure, we're lowering cholesterol, but we're lowering also the production of coenzyme Q10. Why should we care about this? Why should we worry? What does coenzyme Q10 do? Coenzyme Q10 is involved in the second step of the four-step electron transfer complex in mitochondria that feed potential energy, which drives ATP synthetase. ATP synthetase is a miraculous enzyme. It's mechanical. It works like a turbine, and it puts together ADP with phosphate to give ATP. And of course, ATP is the primary currency of energy in the cell. The first step in the electron transfer process, step 1 to step 2, generates a lot of reactive oxygen species, a lot of free radicals. And if that first step gets backed up, there's too much oxygen, then more ROS, more free radicals are formed. And they can be detrimental in the cell, they can damage some things. But actually, Nick Lane, in his fabulous book Transformer, argues that that ROS flux has a bigger purpose. And the bigger purpose is to feed epigenetic signals to the nucleus, which then tells the cell, okay, there's lots of oxygen, you've done your metabolism, relax. But you see, if then we deplete coenzyme Q10, we have artificially high levels of oxygen, more ROS flux. That obviously may have some detrimental effects. I've made another video on taking care of your mitochondria. I even suggest that maybe it's related to declining sperm count all over the world. That's just an idea. What are the organs that contain most mitochondria that should therefore be affected by depletion of coenzyme Q10? Number 1 is the heart. Number 2 is muscle. 3 would be the liver. And 4 would be the brain. Do they correlate in any way with side effects from statins? Well, of course, statins have a lot of effects on the heart. Statins are known to cause muscle pain in some patients. Statins obviously affect the liver because that's where cholesterol biosynthesis is going on. And statins can cause lack of acuity, brain fog. So it all correlates. These mitochondrial effects are not directly a result of cholesterol lowering. They're a result of Q10 in the mitochondria being influenced. Why don't doctors measure Q10 levels in patients who are on statins? The easy answer is they can't. They can look at Q10 levels in the blood, perhaps, that's easy enough to do, but getting whole tissue Q10 levels in the heart, in muscles, in the liver, and in the brain involves biopsies. What patient wants their heart, muscle, liver, and brain biopsied? No one. So it would be nice if there were double-blind clinical trials to see the effect of Q10 levels on outcomes for patients. And I know there's some doctors who dismiss all science and say, it's not relevant unless we have that data. It's never going to happen unless somebody somewhere can develop a non-invasive measure of Q10 levels in patients. In my video on mitochondrial dysfunction, I outline the diseases that can result. I'm not talking about genetic mitochondrial dysfunction. I'm talking about poorly functional mitochondria may cause cancer, heart disease, neurological diseases, metabolic diseases, inflammation, inflammatory diseases, even psychiatric disorders, and aging. And again, it's not possible to look at these in a rigorous clinical trial. I take statins, and in 10 years, I will have a different health profile. I'll be 10 years older, I hope, and there'll be no negative control of me, the individual, to compare with. And even if you look at correlations between people, mitochondrial function is critically dependent upon exercise and diet. So unless there's a cohort of people exercising exactly the same amount on the same diet, taking the same statin at the same dose for a long time, it's impossible or very near impossible to get data on the influence of statins on these diseases. So statins inhibit the production of Q10, and statins inhibit the production of cholesterol and other steroids and these other things I've mentioned. It would be tempting to say for every molecule of cholesterol that's not synthesized, one of Q10 must not be synthesized. It doesn't work like that because the body is skilled with homeostasis. And in fact, one of the feedback levels the body uses for cholesterol is cholesterol itself. The body considers how much cholesterol does the cell have, and if they don't have enough, it sends signals to make some more. Patients who take statins then develop this tension. The cholesterol levels go down, the signal to make more to the cells goes up, and a cycle is started. Again, we don't know the effects of that specifically. But also, if mevalonate is restricted, the body may react in other ways to either borrow that from coenzyme Q10 production or perhaps borrow from cholesterol production to supplement coenzyme Q10 and other things. We just don't know how the pathway is regulated. So should you be afraid that Q10 levels are dropping? Yes, I'm afraid. I'm concerned. I take statins, but I'm not telling anyone what to do. I'm not an MD. I can't diagnose your problem. The first person to listen to should be your physician. But then educate yourself on the science behind statins and know what's going on. They have many effects. I personally am skeptical about the whole idea that cholesterol levels alone cause atherosclerosis. I think maybe there's more to it than that, and particularly oxidation of lipids like linoleic acid in seed oil. But that's hard to prove, and it hasn't been proved conclusively. Statins lower inflammation. And actually, statins are very effective for people who are going to have a stent, like in the carotid artery of the heart. What happens when people have a stent? There's an injury to the blood vessel. When a stent is inserted and blown up, there's bound to be inflammation. If statins can reduce inflammation, that's got to be a good thing. So I'm not telling anyone, take statins or don't take statins. I am saying the science points to this, and you should be informed about what statins do. Ultimately, you should listen very carefully to what the doctor says, but you are responsible for your own health. Thank you very much for listening. Bye-bye.